Welcome to Zeitgeist. I'm Zuri, that's Alistair, and today we're covering something that affects basically everyone.
Yeah, the government just made some big changes to health recommendations, food and vaccines, and the reaction has been intense.
So Health Secretary Robert F. Kennedy Jr. has rolled out two major policy shifts in the past few weeks. One is a complete overhaul of the federal dietary guidelines, what the government says you should eat. The other is a significant change to the childhood vaccine schedule. And both are generating a lot of heat.
Okay, let's start with the food one. What actually changed?
Right, so you might remember the food pyramid from school. Well, Kennedy basically flipped it. The new guidelines put protein and full-fat dairy at the top. Think red meat, whole milk, cheese, eggs. Grains got pushed way down. And there's a heavy emphasis on avoiding processed foods and added sugar.
Full-fat dairy? I thought we'd been told for decades that low-fat was the way to go.
Exactly, and that's a big part of Kennedy's argument. He's framing this as correcting decades of bad advice. His words were that Americans have been misled by previous government nutrition guidance. The new guidelines even encourage cooking with butter and beef tallow instead of vegetable oils.
Beef tallow. Like rendered beef fat.
Yeah. Now here's where it gets interesting. The guidelines still cap saturated fat at less than 10% of daily calories, which is actually the same threshold as before. So the rhetoric is pretty dramatic, but some of the actual numbers haven't changed as much as you might think.
So, what do nutrition experts actually think about this?
It's genuinely mixed, and I think that's important to understand. On the this makes sense side, ultra-processed food really is a huge problem. Studies show it makes up somewhere between 55 and 70% of the American diet, and there's solid research linking it to heart disease, obesity, diabetes, even certain cancers. So the eat real food, cut the processed stuff message, that has broad support, even from Kennedy's critics.
But there's a catch.
There's a catch. The specific emphasis on red meat and saturated fat is where mainstream nutrition science pushes back. There's decades of research linking high red meat consumption to heart disease and colorectal cancer. The beef tallow recommendation in particular. Experts say there's just no scientific evidence supporting that as a health choice.
So it's kind of a mixed bag. Some of it tracks with what scientists have been saying. Some of it doesn't.
That's a fair way to put it. And here's something wild. The American Medical Association and the American Academy of Pediatrics actually endorsed these dietary guidelines. The eat less processed food part resonated. But those same organizations, they're currently suing Kennedy over his other big policy change.
The vaccine stuff.
The vaccine stuff. So in early January, the CDC announced major changes to the childhood immunization schedule. The number of recommended vaccines dropped from 17 to 11.
Wait, they cut 6 vaccines?
Not exactly cut. More like narrowed. Vaccines for hepatitis A, hepatitis B, and meningococcal disease are now only recommended for higher-risk children, not universally. And vaccines for flu, COVID, and rotavirus got moved to something called shared clinical decision-making.
What does that mean in practice?
It means instead of the CDC saying every child should get this vaccine, they're saying talk to your doctor about whether it makes sense for your child. It puts the decision more in the hands of individual families and physicians, rather than being a blanket recommendation.
That doesn't sound crazy on its face. Why are doctors so upset?
A few reasons. First, there's the process. Kennedy fired all 17 members of the CDC's Vaccine Advisory Committee. That's the group of independent experts who review the science and make recommendations. He replaced them with a new committee that includes people who've been publicly skeptical of vaccines.
So the concern is that the recommendations aren't based on the same scientific process as before.
That's a big part of it. 7 major medical organizations, including the American Academy of Pediatrics and the American Medical Association, filed a lawsuit arguing that the new committee isn't fairly balanced as federal law requires. A judge just ruled that the lawsuit can proceed.
And doctors are actually saying they'll ignore the CDC?
Many of them, yes. The American Academy of Pediatrics released their own vaccine schedule that keeps the broader recommendations, and a lot of pediatricians have publicly said they'll follow that instead of the CDC. Their argument is pretty simple. The science hasn't changed.
That's a pretty remarkable situation. Doctors openly saying they won't follow federal guidance.
It really is unusual. Historically, the CDC's recommendations have been the gold standard. Doctors followed them, insurance companies used them to determine coverage, schools used them for requirements. This level of open defiance from the medical establishment is not normal.
What's the argument on the other side? Why make these changes?
The administration's position is that they're bringing US recommendations in line with international practices. Some countries do have narrower vaccine schedules, and there's a philosophical argument about medical freedom, that these decisions should be between doctors and patients, not mandated by the government.
Is there any data on what happens when you narrow vaccine recommendations?
This is where it gets concerning, regardless of where you stand politically. Childhood vaccination rates in the US were already declining before these changes. MMR coverage, that's measles, mumps, rubella, dropped to 92.5%. That's below the 95% threshold you need for herd immunity.
And measles is actually coming back, right?
We've seen the highest number of measles cases since the disease was declared eliminated in the US back in 2000. There have been outbreaks in multiple states, and non-medical vaccine exemptions hit an all-time high last year at 3.4% of kids.
So the worry is that these policy changes could accelerate a trend that was already happening.
That's the fear among public health officials, yes. Though supporters would argue that the previous approach wasn't working either, and a more individualized system might actually build more trust.
So where does this leave regular people? Like, if I'm a parent trying to figure out what to feed my kids or whether to vaccinate them.
Honestly, it leaves you in a complicated spot. On food, eating less processed junk and more whole foods is good advice pretty much everyone agrees on. The specifics about red meat and saturated fat, that's where you might want to do your own reading or talk to a doctor you trust.
And on vaccines?
On vaccines, your pediatrician's recommendation matters more than ever. Most doctors are following the AAP schedule, not the new CDC one. So have that conversation. Ask what they recommend and why. The shared clinical decision-making framework the CDC is pushing. In practice, that's exactly what it looks like. Talking to your doctor.
It's strange that we're in a moment where talk to your doctor is almost a form of resistance.
It really is a strange moment. You have the federal government and the medical establishment openly at odds. That doesn't happen often. And whatever you think about the specific policies, that tension itself is worth paying attention to.
We'll definitely be watching how this plays out, especially that lawsuit.
For sure. The court case could reshape how vaccine policy gets made in this country. We'll keep you posted.
If this helped you understand what's going on, hit subscribe. We break down the news so you don't have to.
Thanks for watching. This is Zeitgeist.